All right, welcome back. Dr. Moses again here. Today we are continuing our topic on acute bronchitis and when is antibiotics necessary? When is antibiotics necessary? Now, if you're a healthy young person, most of the time you don't need any antibiotics, but there are a group of people who will benefit from antibiotics. The first group of people will be if there is an outbreak with pertussis or whooping cough, and you've been in contact with anyone who has had that, and you develop a cough, and you're coughing, you're having that cough where you cough at the end of it, you vomit, you have emesis, you vomit after the cough, or you've been exposed to pertussis, then you are going to benefit from antibiotics, and so your doctor should prescribe one for you without a doubt. The second group of people is that if your symptoms, has certain criteria, like you have a fever over 38 degrees for over 4 days, you are having shortness of breath when you walk, you check the oxygen with a pulse oximeter is, less than 94%, and when you take a few steps, you can breathe, you are wheezing in your chest, those are people that need to go in because you may have atypical pneumonia caused by either mycoplasma, or chlamydia. And so you are going to benefit from antibiotics and it should not be withheld from you. Okay. So that's number 2. And number 3 is that if you're immune compromised, you have things like chronic lung disease, we call COPD, you have asthma, you have CHF, you are diabetic, or you are immune compromised, you are taking chemotherapy, immune compromised, and developing a cough that is not going away with a fever. And that means that you may have acute bronchitis caused by a bacteria. And so this group of people will benefit from antibiotics, and if you're a physician, you should not withhold from them. And the next thing that we want to consider is, if you're not sure, do what we call the CRP levels, which is C-reactive protein, because in the written studies, it's been shown that if that value is very high, then that patient will benefit from antibiotics. So these are the group of people that will benefit from antibiotics. Or if you're able to diagnose a pneumonia, which again, you need an x-ray to diagnose that, then you need antibiotics and it should not be withheld from you if you're developing acute bronchitis. So as we move into the season of the winter, if you're developing any of the symptoms that we've described on our 2 episodes, then check yourself and see if you fall within a category where you are going to benefit from antibiotics. So that is the new consensus for 2025. Those who need antibiotics. Now that question comes, do everybody need steroid inhalers, or do you need an inhaler if you have acute bronchitis? Well, if you are not wheezing, you don't need an inhaler. It's not going to help you. It's not going to benefit from it. But if you're wheezing in your chest, you have acute bronchitis, then you might benefit from an inhaler like albuterol, but not steroids. Steroids is only if you have a chronic lung disease and you have chronic inflammation, then steroids will be beneficial for you. So these are some of the things that you should consider with acute bronchitis, and just check yourself which category we fall in, and when you need antibiotics and when you do not need antibiotics or an inhaler or a steroid. So I hope this has been very helpful to you. Subscribe to my channel, give me a like, leave me a comment below if this has been helpful to you, and let me hear from you, because we are all here to educate one another so that we can live a healthy lifestyle. Now, my next video, I'll share about chronic bronchitis and how to treat that. So until then, Dr. Moses, I'll see you on the next episode.